Services. Today I will be sharing a little with you on chronic obstructive pulmonary disease, also known as COPD. COPD is the name for a group of lung conditions that causes breathing difficulties. It includes emphysema and chronic bronchitis. Emphysema is a lung condition that causes shortness of breath. It is when the air sac in the lungs, which is the alveoli, are weakened and ruptured, which reduces the amount of oxygen that reaches your bloodstream. Chronic bronchitis is when the bronchial tubes become inflamed and narrowed and your lungs produce more mucus. With COPD, the breathing problem tends to get worse over time and can limit your normal activities. Although treatment can help keep the condition under control, it cannot reduce the damage that was already done to the lungs. There are 4 stages of COPD. Stage 1. In stage 1, the main symptoms of COPD are shortness of breath and an ongoing cough, which may be accompanied with mucus. However, because these symptoms are so mild, persons may not realize when they're experiencing them. And although the symptoms are easy to miss, damage to the lungs still occurs. Stage 2, which is the moderate COPD, existing symptoms of stage 1 intensify. Shortness of breath during physical activities is more noticeable and coughing and mucus production may increase. Other symptoms in stage 2 may include wheezing, fatigue, and trouble sleeping. Also, in this stage, this is where most persons may first become aware of the symptoms and then they will seek medical attention. At stage 3, which is the severe COPD, the lung function has significantly decreased. The lungs continue to weaken and it becomes more difficult to take in oxygen and remove carbon dioxide while exhaling. Previous symptoms are more intense and more noticeable. Shortness of breath has worsened. Coughing or wheezing occurs more frequently, and person may also produce thick or mucus. Also, person may experience the following symptoms like extreme fatigue or weakness, feeling confused or forgetful, swelling of the ankles, feet, and legs, tightness in the chest, and more frequent chest infections. Stage 4, which is the last stage, also called the very severe COPD. This is when the lung function becomes very low. Stage 3 symptoms worsen and become more persistent. Also, shortness of breath and chest tightness occur with everyday activities. So it becomes a big effort just to breathe. Other symptoms of stage 4 include a crackling sound when you breathe in, irregular or fast heartbeat, weight loss, and pulmonary hypertension, which is a form of high blood pressure that affects the arteries in your lungs and the right side of your heart. The main cause of COPD is smoking, and also it can be caused by long-term exposure to harmful fumes or dust. Ways to prevent COPD is by avoid smoking. So if you are someone who is already smoking, you can help prevent further damage to your lungs by quit smoking before it starts to cause problems in your lungs. Detecting and treating early stage of COPD is essential to slowing in the progression of the disease. If you're experiencing any warning signs like shortness of breath or persistent cough, you should make an appointment with your doctor to determine what's causing your symptoms. Early COPD screening is important if you smoke, since you face a greater risk of developing the lung disease. In closing, smoking is the leading cause of COPD, and treatment may slow the progression of COPD, but it cannot reverse the damage that is already done to the lungs. There is no cure for COPD, but it can be treated. Until tomorrow, listeners, I'm Nurse Alicia Solomon, the founder of Royalty Home Care and Private Nurse Services. You can send us a message on WhatsApp at 666-3598 or reach out to us on Facebook at Royalty Home Care and Private Nurse Services. Thank you for listening. Bye.